I'm Kirsty. I'm going to be demonstrating how to insert an IV and give a infusion. I would start out by checking the order and the MAR, and we are going to be administering an IV of 0.9% NS solution, 1,000 milliliters to infuse over 6 hours. The drop factor is 10 drops per mil, and we are giving 167 mils per hour. So I will be doing 28 drops per minute. So I would start by getting the bag ready. First, I would perform hand hygiene. I would check the expiration date, which is February of 22. So we are good. Check for any particulates. Check the color. Everything looks good. So I would get ready to spike the bag. Making sure that this is closed so that I don't spill fluid everywhere. I would alcohol the top of this. And then keeping this as sterile as possible. I would spike the bag. And then I would label the bag with my initials, the date, and the patient's name. And hang the bag. And then I would prime my line. Okay, so my line is primed, and I will stop that. And then hang this so that it's ready to be used once the patient has their IV in. So I would perform hand hygiene. Oh, and I would label the line as well with the same information, my initials, the date, and the patient information, patient's name. I would perform hand hygiene, and then I would look for a vein. Okay, so I found one that I want to use, so I would take the tourniquet off and I would get everything ready to start my IV. I would perform hand hygiene. Okay, so I would perform hand hygiene and get gloves on. I would come to the patient. I would check their name, allergies, their date of birth, make sure I have my order ready, checking the 6 rights, the right patient, the right drug, the right dose, right time, the right medication, and then document at the end. So I would put the tourniquet back on. And I would alcohol my spot. I would make sure that my bevel is up, go at about a 30-degree angle. I would tell the patient that they are going to feel a poke. And then I would wait for a flashback, which I got. So then I would advance the catheter and pull out the needle. I would take off my and then apply pressure. And then I would flush with about 5 mils to make sure that everything is patent and good to go. And then discard of that. Would clean the site up. And then take my gloves off. Perform hand hygiene and put new gloves on. I would put a gauze pad underneath of this for cushion, and then I would tape this in place. And then put the Tegaderm over the top, but not over the lock. And then I would label this with the date and my initials. And then I would hook up the IV. and I would check my watch and time out. I would actually alcohol this first. And then I would connect. And then I would time out. I would tape this in place. And then I would time my drops. So we're doing 28 drops per minute. So I would use my watch and calculate that drop. Okay, so I got my 28 drops. So I would check the patient, make sure that they're comfortable, they have their call light, make sure they're not having any pain anywhere. I would document what time I started this and that I started this. And after the patient was comfortable, then I would leave them to let this infuse.